This episode is brought to you by Healthlink Advisors, value, insights, and solutions, expert consultants serving the healthcare industry. Check them out at thisweekhealth.com/healthlinkadvisors.
Today on Newsday.
We've seen what happens when leaders mistake ambition for readiness, right? And sometimes you have to slow down in order to go fast. That makes all the difference.
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Newsday discusses the breaking news in healthcare with industry experts. Now, let's jump right in. Welcome to Newsday, where I am joined by Samme Diaz, a seasoned health IT executive and VP of Advisory Services at Healthlink Advisors, a consultancy dedicated to helping healthcare organizations navigate digital transformation and optimize performance. With deep experience in clinical operations, EHR optimization, and strategic planning, Samme brings both technical insight and leadership depth to her work. At Healthlink Advisors, she partners with health systems to align technology with care delivery goals, ensuring that innovation is not only strategic, but also sustainable. Samme, welcome to the show.
Thank you, Sarah. I'm so excited to be here and get to do this with you. Is really rewarding and just glad to be here.
I'm excited too, because we've known each other for a very long time. And the funny part is we're essentially newer roles and we get to do this kind of work together. So it's the constantly evolving space that we all have in our careers. And it's just fun when you get to do that with people that you enjoy spending time with.
Absolutely. I appreciate that.
Of course. Let's jump into Newsday. I love these articles that we covered. And this obviously takes us back to a lot of our CIO roots. And this is about nurses continuing to name EHRs as a top driver of burnout and resignation. This one highlights the growing concern among nurses regarding the impact of EHRs on burnout and workforce attrition. But it also talks about how clunky user interfaces, time-consuming documentation, and lack of clinical workflow alignment continue to make EHRs a top frustration, often outweighing other workplace stressors. I know nurses aren't alone in this space. Tell me some of your thoughts on this one.
Yeah, I mean, I think a big part of this, we're not doing a great job at making sure that the EHR systems really support the clinicians, especially from a nursing perspective, right? And if we brought them to the table, had more advocacy, more governance around it, I just think that would have a bigger impact for them. And one of the big ones I thought about as I was reading this article is training. So we do a lot of IT-led training. I'm sure some organizations do a great job with nurses, but a lot of times when you bring a nurse in to do training, you're pulling them off the floor and now they're in IT. So they're losing that value proposition of being a true end user. And I wonder how we could kind of come back and circle to having them kind of still as a floor nurse and now as a trainer. How do you help them really show the nurses that they're training so that they can relate to them more? Feels like a big gap that really could be closed. It just seems simple, but I'm sure it's not that simple.
There's a level, though, that can be introduced. When you think about advocating for the optimization, it's not death by committee as much as it is like those frontline staff decisions. And to your point, we love to pull in the nurses into the informatics and roles that support IT. But if we have a hybrid environment where that compliance-driven design and user-driven workflow can really be married more effectively, then the usability, even auditing of those spaces and some of that, I guess, cross-functional feedback, it really creates an environment where nurses are being heard and their ideas are being implemented.
Absolutely. And I think also it's that feedback loop. We implement things all the time, all kinds of technologies, EHRs, you transition EHR to EHR, but where's that feedback loop and making sure that it's operating the way they need it to? It's kind of that like, hey, this is how it functions, but how does it need to work so that they can actually be effective on the floor and take care ultimately of our patients and keep everybody safe? I think that would help with their burnout too, ultimately, if they really had that impact and value proposition.
What was interesting in the article is they talked about hospitals that have magnet status tend to have the obviously happiest nurses and better workflows and better integration with their EHR. But then I dug in a bit and I was like, well, can you get magnet status without having a robust workflow process, et cetera? So when you think about long-term costs of ignoring what that burnout and the tie to technology could look like, what are some of the thoughts you have?
So, I mean, ultimately, if they're happier we're going to attract more talent too. If you've got happy nurses based on their satisfaction with the EHR, and I'm kind of blending in a couple thoughts here, but when you're interviewing for a job, for example, you're asking very specific things. I guarantee nurses are now asking, what EHR are you using? And especially in this article, it talks about nurses under the age of 40. That's extremely important to them, which EHR system you're using. And you think about that, they don't even know what it's like to be on paper. So having that impact on the nurse retention, also some reduced quality of care. So if they're burned out, they're more likely prone to errors. They're going to make more errors. They're stressed out, right? You also have the financial implications. You've got turnover creates more onboarding costs. You've got to then do recruiting. And then you've got your reputational damage. So if nurses are not happy, they're telling their friends in the nursing community that they're not happy and the reasons they're not happy. And if that's all ultimately tied to a system, I mean, that's a big piece of this.
In the work that you're doing with HealthLink, the conversations you're having very strategically, obviously about a lot of digital transformation and bringing organizations forward. How are you seeing the digital experience being part of the overall employee value proposition?
It's huge. It's a big part of their entire digital strategy. And we're not going to use the AI word today, but I mean, it's there, right? So you've got to have a lot of the conversations, I think they're evolving too, and they're different than they were 5 years ago. And right now, like just focusing on it's more of a broader question of what should we be incorporating into our digital strategic plan, right? What should digital transformation look like? And a lot of it is the usability across the board. And if we're not making it easy on everybody at every length, it's not just nursing, right? You've got your lab technicians, you've got your radiology, you've got to be able to incorporate all of that at all ends.
Which is why I love the other article that you chose. And that's about Emory Healthcare debuting the first Apple-powered hospital. And I love this because the Emory team is in the mix of the 229 community, but they have pioneered the nation's first Apple-powered hospital experience using Apple devices and services to deliver a more seamless, connected, and patient-centered care environment. It also integrates Apple's technology with Emory's existing infrastructure to elevate clinical mobility and the patient experience. And that whole relationship where Emory reached out and was like, hey, how come Apple's not involved? Tim Cook responds, and then they get Epic involved. Like, what an amazing partnership that is really paying off in its early report outs.
I love Apple products. The reason I picked this article is like, I would love to never have to use a Windows device ever again. Yeah, ever again. And could you imagine being a nurse and not even having to look at your phone because you could flip your watch and know that your labs are ready? That is amazing. Like, that is just groundbreaking, in my opinion.
It's an ecosystem that people already know and it's easy to use. So they've got Apple Watches, iPhones, iPads, all streamlining clinical communication, and then integrating Apple Health and bedside devices,
Right.
enhancing
Right.
real-time information. And then the other piece, it becomes a model for the future. Like they raise
Right.
questions about interoperability, vendor partnerships, and scalability. I went down my typical rabbit hole and I'm like, hey, what does this mean for your security
Yeah.
platform and
Yeah.
posture? And you still have to be vigilant. But if everybody went this direction, you
Right.
would significantly reduce some costs and streamline workflows, even on the security side, although you'd still have to have things like mobile device management and zero trust infrastructure. However,
Right.
think about what it's like to do business with your family to a
Right.
degree. And we always
Yeah.
talk about those wraparound services of like how you can take care of people and be informed. And all of a sudden, everything's Apple related. So nothing feels like an additional hurdle when you're already in a vulnerable state.
Exactly. Exactly. Well, I mean, you think about how much your phone and your Apple Health already tracks your health. It's not trying to remember which blue pill, right? What color's the pill? What's the name of the pill? It's all there. Everything's integrated on your phone. Are you exercising? Well, I don't know. Am I? Pull up your phone. Here. Oh, yes, you are. Just all of that. Well, and your security piece too. I mean, you think about they mentioned that the increased staff satisfaction, zero turnover during their cyber event, that they literally had the ability to keep the communication going across the board. And all of their Windows devices were locked down, but their Apple devices weren't. So they were able to continue to take care of their patients and still have all of the access at their fingertips. Like, that's amazing.
And like so many systems today, that cyber event was because of a vendor
Correct.
and not because they didn't do what they were supposed to. And yet here you go, the Apple hospital perfectly aligned and didn't have any issues.
Exactly.
When we think about innovation, we think about transformation. It's always expected to be some Valhalla moment in our careers. moving your entire hospital and having support from your CEO all the way through the chain to Apple, to me, that's pretty darn groundbreaking, in all honesty.
Agreed. Agreed. I mean, going to like the change adoption, can you imagine the amount of change readiness to know that everybody in your health system, all of your leaders, everybody's on board with this? It's earth shattering. Like, that's just pretty amazing to know the amount of levels they had to go to, and everybody was like, we're on board.
Although you've got to also think about potential interoperability and sustainability, that initial framework for
Right.
going and doing a consumer grade technology implementation like that is important because not everything integrates as effectively with the Apple ecosystem.
Right.
So I'm thinking though, like getting all your APIs organized, getting all your integrations organized. I would rather have the challenge of getting Apple to work with my environment than everything else that I feel like was always just climbing uphill constantly. Like, what a win because you do that and now it's available for everybody.
Exactly. Exactly. Well, and you can build upon it too. And the fact that it's a complex environment at Emory still, but it's not this massive, cancer center, or they were kind of starting in this space where you could grow and build upon it was brilliant, because then, I mean, that is the future. And if you can do that in a hospital setting, I mean, heck, I was just thinking about removing printers, and here we are. It's a whole Apple centric hospital. Like, I mean, you're shooting for the stars here. That's just a great step in the right direction.
I mean, there was
Yeah.
this conversation about it and thinking organizations will talk about human design thinking or patient design thinking. And yet this really does say, what are people using in their day-to-day life most? Now, I'll be honest, I have a diehard Android husband, period. So I'm like, yeah, but if you were in the hospital, I would be taking care of you sort of. And so I would be fine with all these devices and how things work. So I do wonder though, is it going too far down a path of exclusionary perspectives? Like, what if people, if you're all Epic, all Apple, as an example, are you too tied into a solution? But then how is that different than all of the myriad things we have going on with PC and Microsoft, other partners in those mixes?
Well, and I thought about it too, like, and this sounds terrible, but Apple's easy to use. And that you always hear people when they're talking about Apple products, well, my grandma can use it or my great grandma. And it's very user friendly. So if you flip it, and that was part of this article as well, is the patient can interact. And we have been talking about HIEs and interoperability for how many years? And we really haven't gotten to the point where us as the patient are in charge of our actual medical record. So now I look at this and I'm like, I can actually manage my medical record, my medical history everywhere I go. I can travel, I can do all of the things and have it at my fingertips. And I can go in, I can check in, I can track my own orders in the hospital and not just keep telling my family I'm going to be here for another 10 hours, right? It just feels like it's helping bring the patient into the mix and really help them advocate for themselves too.
Well, and consider just the last article we covered. If now you have an ability to introduce Apple devices that
Right.
not only improve mobility from reducing friction in clinical workflows that frees up time for patient care, but you actually have adoption rates and time saved and the reduction in burnout for the
Yes.
nurses too, because ambient listening is taking a
Yeah.
massive foothold. And everyone's excited about it. It's first time in the 20 years since all these different regulations came into play where people are excited, especially clinicians, about
Right.
technology. That is ambient listening. Now you have ambient listening with Apple products. All of a
Yep.
sudden, once we're waiting for ambient to catch up with nursing workflows, you have a bunch of wins for your nursing staff as well.
Exactly. When I'm thinking about digital transformation and some of our partners working with Healthlink, this is a pipe dream. Like, hey, look at what Emory did, right? Being able to say, this is innovation. Look how far they took their ideas and look at what they were able to create. Definitely a story I want to continue to follow because I want to see how they do as things evolve, especially with the Epic relationship.
I'd also like to believe that it can be done with other EMRs as well.
Yes.
You're not
Oh,
just
yes.
have to be Epic to do this. You could do this
Absolutely.
with Oracle. You could do this with Meditech. You could do this with myriad others. And that Apple starts to become more of a baseline than just the EHR being a baseline.
Exactly. Agreed. Agreed.
They can be mutually exclusive and still complementary to one another.
Right. Right. No, that's a good point.
I've always enjoyed diving into these stories with you, not just because of the headlines, but because we both sat in the CIO chair and we know what it means to translate strategy into reality across systems that are always under pressure.
I think that's, one thing to admire innovation from the outside. It's another to actually assess. Is our organization truly ready for this? Do we have the platform maturity? Is our leadership ready? Are they aligned? The integration capacity. And then the other part of it is, do we have the talent? And I think that's a hard part, because do you want to admit you don't have the talent? Okay. Are you willing to invest and spend the time to get your talent ready to have what they need to actually make these changes?
Which is why this is so much of a conversation around the total C-suite, because you might be rethinking EHR usability for nurses or rolling out consumer grade tools like Apple in a clinical setting. And you and I both know the success of these efforts isn't always about the technology. It's understanding the organization's appetite for change. You and I both love change structures because mostly the human element. Where can you stretch this? Where can you maybe push too hard that breaks momentum, or worse, where do you break trust? And it's interesting, that whole talent component starts with the people that are going to be investing, knowing that your team can handle something as
Yeah,
transformational as making some of these bigger changes. And if you don't have the trust already in the capabilities of your team, then it doesn't matter how well thought out the strategy or technology is. You still have to have the people to execute the
that's
actual
right.
work around you.
That's right. And we've seen what happens when leaders mistake ambition for readiness, right? That's where the fortitude to ask the tough questions. And sometimes you have to slow down in order to go fast. That makes all the difference. And if you're not, you mentioned change. Like, I love change, but does that mean that everybody that's working with me is able to execute on the change I want to do? That's a big question. And that's a tough part of this.
I remember at a previous lifetime putting in almost like a change readiness score, like how willing is our organization actually going to absorb what we're putting in front of us? And
Right.
it always is going to come back to both, we mentioned the talent, but the timing of certain initiatives, because you can have the best technology in the world and people not being prepared or cultural misalignment, it's going to stall out. And then leading that transformation takes the vision, but also the humility and I think the strategic patience, for lack of a better term. And I mean, let's be honest. I mean, both have left organizations where we are wired to do things like we're talking about.
Right.
And if you don't have an environment that lets you thrive and do those things, then you also have to go find a new environment. And that can be scary for some people. And so I always encourage CIOs or anybody in that suite to say, am I in the right place to do the things I want to also do with my career?
Absolutely. I can't agree more. And for any C suite listening today, I'd challenge you to look at not just the tech headlines, but ask yourselves, where is my organization truly ready to evolve? And how do I lead us there in a way that sticks? Paying attention to that and wanting the new technology, to your point, you've got to make sure you're not just great at implementing technologies. You've got to be great at telling the story. You've got to be great at having the talent, making sure you're keeping them completely educated and certified so that they can continue to take care of that as you evolve.
And in your new role, you've been with HealthLink 4 or 5 months now?
5 months, yes.
5 months. What are you already seeing, though, that is the appetite for change and the ability to implement things as thoughtfully as the discussion for reaching out to you in the first place?
Yeah, I look at it like you've got organizations that know they need to refresh and maybe even just like rebuild their relationships with their customers. And so they're looking for a roadmap, or, hey, we've got all of these different technologies that we want to implement, but we don't know how to actually execute or timelines based on all the things we have going on. And so you can tell, like, the change appetite is there. They just need the path kind of paved. And if you don't have the experience and you're seeking it out, that's what I love about HealthLink is there's so much talent, and every person I talk to at HealthLink has done something on some capacity. And so being able to bring that in to then a health system and help them kind of pave the path, it's really amazing to watch. And to your point, getting to kind of use those talents and those strategic thinking in a different element is just pretty amazing. There's so many opportunities out there with like radiology platforms that we're looking at. Like, there's AI and everything now. It's just a matter of how are you going to use AI? You've got to ask yourself that question too. Like, what is your organization's appetite to truly use AI for efficiency of your IT staff along with your clinical decision making? Like, you've got to be in that, which path are you willing to go down? That's a big part of that too.
And Bill mentioned, I think it was an article recently, talks about that. Like, don't have the EHR or your partners AI strategy drive yours, you as an
Right.
organization need to have them adapt to the things
Yeah.
you're looking to achieve. And if you don't know how to do that, you bring in the partners that can have those conversations with you. But pretty fascinating how you're not being fed. It's like you need to also go out and feed and be able to
Right.
really drive the things that make sense, like something that Emory did with Apple.
Absolutely. Yeah. Agree. Could not agree more.
Such a great conversation with you, and I'm grateful that we get to keep having it together.
Yes. Thank you so much. This has been great. I really appreciate being on here today with you.
Thanks for listening to Newsday. A lot's happening in our industry. And while Newsday covers interesting stuff, another way to stay informed is by subscribing to our Daily Insights email, which delivers expertly curated health IT news straight to your inbox. Sign up at thisweekhealth.com/news. Thanks for listening. That's all for now.